My name is Chris Arant. I'm an interventional cardiologist here at Tanner. We're here today to talk about open heart surgery and what it means to Tanner and what it means to our community. Heart disease is a broad term that encompasses issues related to heart rhythm abnormalities, blocked arteries, or even valve-related issues. The valves in the heart let blood go through the heart in one direction, but not the other direction. Here at Tanner, we're currently able to take care of most cardiovascular issues that arise for our patients. For instance, we can do stenting procedures to open up blocked arteries. We have various procedures that we can do to help with abnormal rhythms. But bringing open heart surgery to Tanner allows us to take care of that next level care. Most of the patients these days can be treated from a blocked artery standpoint with stenting procedures or even medical therapy. Open heart surgery, however, will allow us to take care of the next level care if someone has advanced blockages that need bypass. Now, that is not a large percentage of our patients, but it is a percentage of our patients that when it's needed, it's needed. So being able to provide open heart surgery will allow us the ability to do that now. It will also open up our ability to even do more advanced stenting procedures that we're currently not being able to offer here at Tanner. A lot of procedures now require that you have open heart surgery for backup if needed, but we're not currently able to offer those procedures here at Tanner. So we'll even be able to expand our spectrum of care as it relates to less invasive treatment because we have open heart surgery here at Tanner.
I was recruited in 2006 to start the PCI program, angioplasty stenting program at Tanner Health System as part of clinical trial from Seaport Study. I was the principal investigator from Johns Hopkins University that was looking at doing angioplasty and stenting in patients without bypass backup. These services have really changed local care, and these services at that time were obviously in their infancy, in their initial stages, and they've evolved over years. The clinical study, the trial, was successfully completed in a few years after we were here, and then we obviously started doing these procedures without bypass backup as required and as allowed by the state of Georgia. Clinically, they have immensely changed outcomes. We were able to offer services that are needed urgently, emergently, and electively locally without patients having to travel, especially in patients that are having heart attack. This is a great service for patients that direly need attention and need to be treated immediately and do not have time to be traveled and transferred to a different hospital. So the clinical care has evolved over years. We offered these services, but also other services for patients that needed cardiac care. We have increased our ability to offer electrophysiology services. We have offered as endovascular services for patients that need procedures for their circulatory system at other places other than the heart. With the open heart services being offered here, we would be able to offer other cardiac services that we were limited previously. For example, we would be able to expand our electrophysiology program, which is taking care of the patients with rhythm issues. And these services were being offered here at Tanner previously, but further services such as ablation and other advanced procedures had to be done in hospitals with bypass backup. We're actively working on our electrophysiology services and service line, and hopefully in the next few months, as open heart comes, we'd be able to offer those patients these services locally without having them to travel. In addition, angioplasty and stenting, which is what we currently do, there are some exceptions. There are some patients that have to be traveled because of need for bypass backup as required by state. Once open heart's here, we would be able to offer those services locally without patients having to travel. I'm very confident over the next decade we would see these service lines expand even more. I believe that we would be able to take care of even more patients here. Our bigger goals in this county and our neighboring counties is to really affect long-term morbidity and mortality of the patients. We want to expand in our preventive services. We want to expand in our current patient needs and then future needs. And I think this is a whole spectrum of disease that we want to address from one end to the other.